Hello, and welcome to the Pharmacy Times News Network. I'm Nicole Grisano, your host for our Pharmacy Week in Review. There are now 5 confirmed cases of coronavirus in the United States, but the CDC has stated that the threat to the general public is still low, Pharmacy Times reported. The virus, first seen in Wuhan, China, is characterized by mild to severe respiratory illness, including fever, cough, and shortness of breath. This human-to-human coronavirus is being spread by travelers to the Wuhan region, and the CDC is recommending that people avoid non-essential travel to China. Should a patient be suspected of having the virus, the CDC recommends that providers give the patient a face mask, follow standard contact and airborne precautions, and advise caretakers and patients to follow diligent hand washing and cough hygiene. Women who breastfeed their infants exclusively for 7 to 12 months may have a significantly lower risk of early menopause than those who breastfeed their infants for less than a month, Contemporary Clinic reported. Researchers analyzed data from more than 100,000 women aged 25 to 42 years who had responded to detailed questionnaires every 2 years on their health information and medical history, including pregnancy history. Women who had breastfed for a total of 25 months or more during their premenopausal years had a 26% lower risk than women who breastfed for less than a month. While the study did not determine why pregnancy and breastfeeding might lower the risk of early menopause, the researchers feel that because pregnancy and breastfeeding stop ovulation, the slowing of egg loss may delay menopause. Patients with colorectal cancer who live in areas with lower income and lower education had worse outcomes and a higher mortality risk, Specialty Pharmacy Times reported. A study was the first to explore socio-demographic disparities in young adult patients with colorectal cancer and to study whether residential location correlates with outcomes such as overall survival. Young adult patients from the lowest income and education areas had the worst median overall survival compared with individuals residing in higher income areas. Additionally, patients in the lowest income areas were more likely to be Black, not have private health insurance, have more comorbidities, and present with more advanced cancer. Pharmacists may get more questions about Descovy if patients have seen a recent commercial for the prescription medication. In the spot called Prep Up, the narrator explains that Descovy is a new once-daily prescription PrEP option from the makers of Truvada. According to the commercial, Descovy is a prescribed medication that is intended to lower the chances of contracting HIV when taken regularly as ordered. For more great coverage and practical information for today's pharmacist, visit our website and sign up for our daily e-news. And don't forget to follow us on Facebook, Twitter, and Instagram. Thanks for watching our Pharmacy Week in Review. I'm Nicole Grisano at the Pharmacy Times News Network.